My name is Dr. Christine Sorial. I'm a family physician in the Tri-Cities, and this is Meadowbrook Family Practice. So, at Meadowbrook, I think the philosophy is that we work together. We're a very collaborative and collegial group. I think because we all have our strengths and weaknesses, nobody's perfect, and we all ask each other questions all the time. And so it's important just for you to have that feeling of comfort and to feel safe in an environment where you do feel comfortable asking questions or reaching out if you need some help. So I think that's a big part of it. We try to foster that here. But truthfully, where we work is a big part of us, who we are, and it's important to be in an environment where you feel connected, you feel like you're really part of a team, that you feel comfortable, and that you like just the flow and the way that the clinic works. And so my advice is be picky about where you settle, because that's where you're going to spend the majority of your time. I love the physical space. We'll start with that. I love that it's open, it's really bright. We have a shared sort of space in terms of where the physicians work. So we always feel like we're part of that team. We're not, we don't work in like a small closet. We're not sort of all independent doing our own thing. So we really sort of have that sense of partnership and collegiality, like I mentioned before, and I love looking out the window and looking at all the green space. So I love the physical space that we have, the clinic itself. The nice thing is that the owners or the managers of the clinic work in the space, so we're constantly getting feedback. We have regular staff meetings where we try to take in any concerns or feedback from our associates and incorporate them. There's lots of flexibility in terms of hours, virtual care, at home work, in office work, weekend availability, evening, daytime. So we try to accommodate everybody's scheduling, and a lot of us do other things outside of family practice too. So some of us work in hospital-based settings or other specialty clinics, obstetrics, long-term care. So we sort of do lots of different things. We do teaching. So we try to accommodate people's interests outside of the clinic as well. So overhead here is, again, it's pretty flexible. It's a bit individual. So for some associates, depending on the work that they do, it's on a percentage, and it depends on the type of work and whether it's evening or weekend or daytime. And then for most of us, it's a fixed overhead. So it's kind of nice. It's predictable. Every day that you work, you pay a certain amount. And again, that amount fluctuates. So depending on the needs of the clinic, but more or less it's sort of a reasonable amount. Usually it's about 30%, as most places have. It could be less depending on the type of work that you do, or the volume, complex care, or chronic disease management. And we try to make it fair so that everyone feels like they are well compensated, but at the same time that they're contributing to the collective running and operations of the clinic. So we are utilizing MedAccess, which is a TELUS-based system. It's a really smart EMR. We've optimized it by utilizing templates, so it's great for templates. We've got tons of templates for CDMs, complex care, so it just makes the workflow much more efficient. And the EMR itself can also run reports, so it can remind you when your patients are due for their CDMs, for example. It can tell you which patients are, for example, meeting their targets for A1Cs if they're diabetics, or for blood pressure for patients who have hypertension. So it's a really smart EMR in that way, and it just also helps even with income generation. Again, it reminds you when the CDMs are due. It can generate reports of which patients qualify for complex care or mental health planning, various things like that. So it just allows us to work and maximize what we do.